Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. Which of the following aspects of nursing is essential to defining it as both a profession and a discipline? Option A. Established standards of care. Option B. Professional organizations. Option C. Practice supported by scientific research. Option D. Activities determined by a scope of practice. Right answer is Option C. Practice supported by scientific research. The American Nurses Association, ANA, has developed standards of care, but they are unrelated to defining nursing as a profession or discipline. Having professional organizations is not included in accepted characteristics of either a profession or a discipline. A profession must have knowledge that is based on technical and scientific knowledge. The charge nurse on the medical surgical floor assigns vital signs to the nursing assistive personnel, NAP, and medication administration to the licensed vocational nurse, LVN. Which nursing model of care is this floor following? Option A. Team nursing. Option B. Case method nursing. Option C. Functional nursing. Option D. Primary nursing. Right answer is Option C. Functional nursing. With team nursing, an RN or LVN is paired with an AP. The pair is then assigned to render care for a group of patients. In case method nursing, one nurse cares for one patient during her entire shift. Private duty nursing is an example of this care model. This medical surgical floor is following the functional nursing model of care, in which care is partitioned and assigned to a staff member with the appropriate skills. Paul Jake suffered a stroke and has difficulty swallowing. Which healthcare team member should be consulted to assess the patient's risk for aspiration? Option A. Respiratory therapist. Option B. Occupational therapist. Option C. Dentist. Option D. Speech therapist. Right answer is Option D. Speech therapist. Respiratory therapists provide care for patients with respiratory disorders. Occupational therapists help patients regain function and independence. Dentists diagnose and treat dental disorders. Speech and language therapists provide assistance to clients experiencing swallowing and speech disturbances. They assess the risk for aspiration and recommend a treatment plan to reduce the risk. Which of the following is/are an examples of theoretical knowledge? Select all that apply. Option A. Antibiotics are ineffective in treating viral infections. Option B. When you take a patient's blood pressure, the patient's arm should be at heart level. Option C. In Maslow's framework, physical needs are most basic. Option D. When drawing medication out of a vial, inject air into the vial first. Right answer is Option C. In Maslow's framework, physical needs are most basic. Theoretical knowledge consists of research findings, facts. For example, antibiotics are ineffective, is a fact, principles, and theories. For example, in Maslow's framework, is a statement from a theory. Instructions for taking a blood pressure and withdrawing medications are examples of practical knowledge, what to do and how to do it. Which action represents the appropriate nursing management of a client wearing a condom catheter? Option A. Ensure that the tip of the penis fits snugly against the end of the condom. Option B. Check the penis for adequate circulation 30 minutes after applying. Option C. Change the condom every 8 hours. Option D. Tape the collecting tube to the lower abdomen. Right answer is Option B. Check the penis for adequate circulation 30 minutes after applying. The penis and condom should be checked half hour after application to ensure that it's not too tight. A 1-inch space should be left BTW the penis and the end of the condom, Opt 1. The condom is changed every 24 hours, Opt 3, and the tubing is taped to the leg or attached to a leg bag. An indwelling catheter is taped to the lower abdomen or upper thigh, Opt 4. The catheter slips into the vagina during a straight catheterization of a female client. The nurse does which action? Option A. Leaves the catheter in place and gets a new sterile catheter. Option B. Leaves the catheter in place and asks another nurse to attempt the procedure. Option C. Removes the catheter and redirects it to the urinary meatus. Option D. Removes the catheter, wipes it with a sterile gauze, and redirects it to the urinary meatus. Right answer is Option A. Leaves the catheter in place and gets a new sterile catheter. The catheter in the vagina is contaminated and can't be reused. If left in place, it may help avoid mistaking the vaginal opening for the urinary meatus. A single failure to catheterize the meatus doesn't indicate that another nurse is needed, although sometimes a second nurse can assist in visualization of the meatus. Opt 2. Which statement indicates a need for further teaching of a home care client with a long-term indwelling catheter? Option A. I will keep the collecting bag below the level of the bladder at all times. Option B. Intake of cranberry juice may help decrease the risk of infection. Option C. Soaking in a warm tub bath may ease the irritation associated with the catheter. Option D. I should use clean tech when emptying the collecting bag. Right answer is Option C. Soaking in a warm tub bath may ease the irritation associated with the catheter. Soaking in a bathtub can increase the risk of exposure to bacteria. The bag should be below the level of the bladder to promote proper drainage. Opt 1. Intake of cranberry juice creates an environment non-conducive to infection. Opt 2. Clean technique is appropriate for touching the exterior portions of the system. Opt 4. During shift report, the nurse learns that an older female client is unable to maintain continence after she senses the urge to void and becomes incontinent on the way to the bathroom. Which nursing diagnosis is most appropriate? Option A. Stress urinary incontinence. Option B. Reflex urinary incontinence. Option C. Functional urinary incontinence. Option D. Urge urinary incontinence. Right answer is Option D. Urge urinary incontinence. The key phrase is the urge to void. Option 1 occurs when the client coughs, sneezes, or jars the body, resulting in accidental loss of urine. Option 2 occurs with involuntary loss of urine at somewhat predictable intervals when a specific bladder volume is reached. Option 3 is involuntary loss of urine related to impaired function. The nurse will need to assess the client's performance of clean intermittent self-catheterization, CISC, for a client with which urinary diversion. Option A. Ileal conduit. Option B. Cock pouch. Option C. Neobladder. Option D. Vesicostomy. Right answer is Option B. Cock pouch. The ileal conduit and vesicostomy, Opt 1,4, are incontinent urinary diversions, and clients are required to use an external ostomy appliance to contain the urine. Clients with a neobladder can control their voiding. Opt 3. Which focus is the nurse most likely to teach for a client with a flaccid bladder? Option A. Habit training, attempt voiding at specific time periods. Option B. Bladder training, delay voiding according to a pre-scheduled timetable. Option C. Creedy's maneuver, apply gentle manual pressure to the lower abdomen. Option D. Kegel exercises, contract the pelvic muscles. Right answer is Option C. Creedy's maneuver, apply gentle manual pressure to the lower abdomen. Because the bladder muscles will not contract to increase the intra-bladder pressure to promote urination, the process is initiated manually. Options 1, 2, and 4 To promote continence, bladder contractions are required for habit training, bladder training, and increasing the tone of the pelvic muscles. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.